World Pharmacists Day is designed to bring attention to the role of pharmacists in improving health globally, and it provides an excellent backdrop to discuss advancements in health and wellness services. One such advancement is the innovative solution offered by ZoomDoc Health, designed to alleviate the burden on GP services and the NHS. ZoomDoc is a proactive solution intended to ease the immense pressure on GP services and the NHS by offering a unique service that provides same-day doctor's letters without the need for an appointment or a face-to-face GP consultation. This innovative solution is crucial, especially in a time where healthcare systems are stretched. ZoomDoc provides a range of essential letters such as sick notes, travel letters, and university sick notes, normally costing around £50 when obtained through NHS GPs and occupying valuable appointment times. With ZoomDoc, these private letters are more affordable, ranging from £35 to £40. These services are particularly helpful for individuals experiencing minor ailments like colds, flu, and gastric issues when getting a sickness letter from an NHS GP is arguably not the best use of the medical professional's time. But what about the credibility of the requests for sick notes? Well, ZoomDoc employs qualified doctors based in London to conduct everything online, ensuring that each case is thoroughly assessed and the right advice and documentation are provided. The service is accessible to anyone in the UK, bringing qualified consultation to everyone. ZoomDoc is collaborating with a well-known chain of pharmacists. This partnership aims to further ease the NHS burden and ensure that patients receive the right care and remedies promptly. It underscores the essential connection between doctors and pharmacists in providing holistic healthcare solutions. ZoomDoc offers home testing kits, another step towards making healthcare more accessible and user-friendly. This innovative approach aligns well with World Pharmacists Day, reflecting the ongoing evolution and diversification in health and wellness services. We are joined today by Dr. Kenny Livingston to find out more. So, Kenny, great to see you. And first question, what solutions are ZoomDoc Health providing?
So at ZoomDoc, we have essentially reinvented same-day medical letters, certificates, and GP referrals without the need to speak to a doctor or GP or even have a GP appointment.
And I mean, we've had sort of great and very extensive discussions today about how ZoomDoc is supporting the NHS and GPs. So before we go into the specifics, can you just tell us some of the latest stats? They're pretty shocking.
They are. I mean, the news out today, there's over 7.75 million people on the NHS backlog. That's about a new high. There's about 1 in 7 people in total that are waiting for some type of medical procedure. Even this last month, over 1,000 people a day are waiting more than 12 hours in A&E departments. I mean, it's pretty disastrous.
And how is ZoomDoc supporting the NHS and GPs?
So our aim is, essentially to try and take the pressure off GPs, primary care, with tasks which essentially do not need to be undertaken by NHS GPs. And, simple things like a medical letter, certificate, referral, that doesn't need to be undertaken by, take up a 10-minute slot in primary care. Our team have devised a solution which is reducing pressure on those GP practices. In the last year alone, we've done almost 40,000. And, it's a small part, but we are seeing a huge adoption of this new service, and we expect that to grow rapidly.
What sort of stuff are you seeing on the front line? Is it kind of aligning with what you're reading in the papers?
Yeah, no, absolutely. We're seeing a lot of patients who are struggling to access primary care NHS services for all manners of conditions, some chronic health conditions and some very simple conditions, which actually a lot of the simple conditions, they should be going to pharmacies. They should be getting sort of simple advice from elsewhere. But the services are stretched within the NHS, and people see the A&E as a lot of people see as the only place where they can go.
Given the sort of backdrop or the background that you've described, sort of escalating numbers, waiting lists, etc., and also the pressure that you're witnessing yourself on the front line. How is ZoomDoc supporting the NHS and GPs? How are you guys helping take the pressure off?
So So the service, obviously, that we provide, some would say it's a kind of slightly trivial service. It's providing a simple letter, certificate, or referral, but that sort of trivial service is actually, it takes a GP or an NHS doctor 10 minutes that you're taking up to make an appointment or speak to them, chat to them about your health condition, whether that's gastroenteritis, COVID-19, flu, whatever you have. You're chatting to them about it. You personally probably know very well how to manage that condition yourself, but you're essentially, in my opinion, wasting that NHS GP's time to get a bit of paper, so that you can provide that to whether it's an airline, a university, a workplace. So providing this service at ZoomDoc, we are reducing the need to bother your NHS GP and allow them to get on to more important appointments before patients actually need it.
Fantastic. And how do you know those requesting sick notes are telling the truth? I mean, that's an excellent point. So, you must have pretty sort of stringent verification processes.
We do. We've got very stringent procedures, as you'd expect, to ensure that patients are giving reliable and truthful information. That's everything from uploading a video. We need to confirm the identity of who the patient is, their passport or driver's license. They're filling in questionnaires. And also uploading lots of different medical information, whether that's medical letters, all sorts of things. It might be simply, showing the medication that they're taking. Our team of doctors, we've got a team of doctors that assess and review all that information before deciding whether to provide that medical letter or not. And there's a percentage that we don't provide the medical letters to. So if they don't have enough information, or it's deemed that it's not, it doesn't seem like it's truthful, then we don't provide it. We give them a full refund.
Fantastic stuff. And I mean, it was really, really interesting talking about the changing sort of landscape of pharmacy. So before you tell us a bit more about your work with pharmacy partners, sort of high street pharmacy, and sort of independent pharmacy as well, which have been real sort of bastions of British high streets for centuries, I suppose. The landscape's very rapidly changing.
It is indeed. A lot of pharmacy services are going online. There are now multiple online pharmacies, and we've partnered with the largest online pharmacies in the UK to provide and enable them to provide same-day medical letters, certificates, and referrals. And with their reach, they'll be able to help support, again via ourselves and in partnership, to reduce the pressure on the NHS, which, in my opinion, is what it's all about.
Well, exactly that. And, I mean, I don't think you said the service might be viewed as trivial. I don't think it's trivial at all if it's providing, an essential component of NHS work, and, freeing services up to, as you say, do the more pressing tasks.
Yeah, absolutely. I mean, actually, a lot of the services that we provide, they're actually deemed non-NHS services when you are getting them from the NHS. So, you are, rocking up at your GP surgery or speaking to them for 10 minutes, 15 minutes on the phone about your healthcare condition, so that you can provide, they can provide you a medical letter or certificate at the end of it. But your NHS GP is going to charge you for it. They're going to charge you £50 plus for a service that the NHS doesn't see that it's their responsibility. So that NHS GP is, they are going to provide that service, take that service that they would be providing a way to, instead of seeing, someone who has cancer symptoms, they're essentially seeing yourself so that you can get your letter for your holiday cancellation, and then charging you for solutions.
And we were discussing upstairs. I mean, it's a brilliant idea. So kudos. The idea of providing a sort of framework or an umbrella for independent pharmacy to operate under. So can you just tell us a bit about the thinking behind that and how that'll work?
Absolutely. So our belief is that we need to empower pharmacists and pharmacies on the ground, the independents, to be able to provide additional services and revenue streams, because they're struggling as equally as GP services are struggling. So the frame that we have set up allows pharmacy chains to provide medical letters and earn an income stream as well. So they can actually provide a service which NHS GPs arguably shouldn't really be providing any of these non-NHS medical letters in the first place. So they're, number one, taking the pressure off the NHS GPs, and number two, pushing more services into pharmacy, which is part of the government first approach.
And, with GP services and the NHS stretched, do you see the future of healthcare becoming more digital? Do you think it's inevitable that it'll continue to go that way?
I think it has to. There's not enough healthcare professionals. There's an ever-increasing population. We need to utilise and work with different digital healthcare solutions to streamline and make the systems more efficient. The numbers of people on the back, that are on the backlog for routine procedures, and the numbers of people waiting in A&E departments and just waiting for a simple GP appointment, sometimes weeks. We need to have better solutions to reduce that. And, this one solution that we're providing is taking, obviously, pressure off NHS GPs on the ground and reducing some of the 7 million non-NHS appointments that are taken up just simply for a medical letter or certificate.
Again, impressed that you've come, from a shift at the Royal Free last night to come and sort of spread the message this morning. So can you tell us a little bit about your background and how that sort of led into the inception of ZoomDoc?
Absolutely. So, I started in the NHS, and I still work in the NHS to this day. I'm a GP by training, and I started this journey with ZoomDoc probably about 9 years ago now, when as a NHS GP I was frustrated with the access that both patients had towards GPs like myself. It was bad 9-10 years ago. It's far worse today. And I started the journey at that time. Initially, we launched the UK's first on-demand telephone, video and home visiting GP service. And we've evolved since then. We were one of the UK government testing providers during the pandemic, testing in hundreds of thousands of people. And now, since then, we've digitalised this new healthcare service to really reduce pressure on NHS GPs and primary care, at the same time while supporting pharmacies, both online and independents on the ground.
Great. And where can people go for more information?
Absolutely. So more information can be found at our website at zoomdoc.com. And additionally, in the next few days and weeks ahead, you'll start to see some of the largest UK online pharmacy chains that are providing same-day medical letters, certificates and referrals, powered by our team at ZoomDoc HQ. In addition, there's many independent pharmacies across the UK that are now providing the same service. So there's going to be lots of information out there.
Dr. Kenny Livingston, thank you so much.